When people come in, just like you folks did, you'll be screened for COVID, making sure you got the right protective masks on and so forth, and then there'll be a registration process. Obviously, with only doing 120 people today, it's not going to be near as busy, but we're building this for scale for the future so that we can run this with a lot more people in here. So people will come in here. This is a waiting area. You notice socially distanced away from everyone else. And then, just like a normal waiting room in a clinic, you'll be called up to your place with the vaccination station. We're really working on a 9 to 5 model this week. 2 weeks from now will be 12 hours. So we're still in the process of determining what the upper limits are with that. After you get your vaccine, you need to stay around for about 15 minutes. We want to make sure that no one has an adverse reaction. If they do, we want to deal with that. Unlikely occurrence that it would happen. And we also want to record that and understand what the circumstances were. Before you leave, you have to check out. We have to assure ourselves that you've actually waited that 15 minutes, but also give you information about the vaccine, a record of your vaccination, and then as well ensure that you know when you're coming back for your next visit 21 days hence. Again, one big loop, no doubling back, just an efficient flow. It's almost like I wouldn't say a drive-through, but it's a walk-through type of operation. This is one of the most exciting days for people who work in healthcare. We just had a group meeting with all of our staff here today. Everyone is pumped. We know that this is a game changer for our community. Some people call it the beginning of the end of the first phase, or the end of the beginning, you know, whatever that nomenclature is. But this is really the only tool that we've had to combat COVID. And we haven't had anything like that before. We've been doing physical distancing, masks, and so forth. There have been some drug treatments. But this is the only thing that's going to turn the corner for our communities, and the only thing that's going to turn the corner for our country. So the people here, they're going to be noting this on their diary as a big day for them, participating, and it is a great day for our community. So in short answer, we are pumped about this. So.